I just, before we start, I think, I don't know if there's like a sign-in sheet or somebody can I can keep track of who of our members are on this.
Pam, it'll be
that
automatically
might be a
recorded.
good idea.
No, we know who
Is that
attending.
right?
Oh, you do? Oh,
Yes.
okay, good. Okay.
Okay, so somebody's got a handle on that. First of all, I do want to let you know that we're open to questions as we go along. Feel free at any time. And we're not here trying to make you gurus of care or anything of that nature, but just to give you some ideas of things to look out for. We're all volunteers after all, and I'm one also, by the way. And if you don't know who I am, I'm on the board with Pam and have been involved with the village for some time. In your notes, you'll see that we put here various things, and it's all listed in various connections. And if you have a problem hearing me or I'm talking too fast, please let me know, because I have a habit of doing that. Caring for adults is always, especially aging ones, is always a challenge. But we don't want to take away from their sense of freedom and independence. It's important that that all of our village members feel that they are in control, even if they're not totally in control. When you are meeting with them, getting to know them, kind of keep your eyes open and observe what you see around you, because those are where you'll get the red flags. And I know Michelle will go through some of those with you. As you get to know them and you continue to see them, be aware of changing habits, conversation, and behaviors. It's very important to do that. And those will be explained more as we go along. Excuse me. I'm having a problem today. My brain's a bit mushy today because I've come off having a really bulldozer of a cold, which was my husband's New Year's present to me this year, which he's not put him in bed tonight with me at all. Thank you. So today we're going to talk about things that like balance and hygiene, appetite and nutrition, and safety hazards. Just so that you are aware of things that you might need to make a comment about. Let me tell you also that if you see something not going well and you feel that people are in need of help, don't call their loved ones. You're better off calling 911 and then letting one of the people in the buddy program know about it. That way things are a little bit more organized and much more well, in a better situation. I think that getting family members involved before there is a need to be involved with, sometimes it's not always a good thing to do. You cause a great deal of panic, and that's not a good thing.
Can I just interject on that? Is that a standard practice? Because I feel like if I'm with somebody and I notice something, I would have them call their emergency contact and maybe just explain to them, this is what I'm going to do.
If you've got a problem and you think it's of emergent nature, you call 911 and then you call the emergency contact. That is the rule. You call 911 first. If you think now, obviously, if it's just something like, oh, they look like they're beginning to hoard, or there's other things of a lesser emergent nature, then that might be something you might want to discuss with Supriya or with Jennifer, and then go to the family members, dependent on what it is. I mean, I think all of us know when there's a real danger and we call 911. We don't wait around, we just call 911, right. Deal with that. If you think somebody, for instance, is being scammed, then that's a different thing. I think then yes, you inform the village office, and you're very careful about who else you inform after that. There is a protocol, I think, in place for what we do with those sorts of things, those sort of issues. If it was up to me, because I'm a mandated reporter, I go directly to APS, the fraud squad, and the district attorney to inform them. But it's a little different for you guys. And so we need to be very careful of that. That's something we can talk about.
Because I'm just questioning who, the approval of the program manager, assistant program manager, which would be like Jennifer or Supriya, is that? who-
Yes. Yes.
Okay,
I think that in the past it has been. It has been. Because I think that we need to be very careful. This is very sort of confidential, and we need to be very careful how we manage these sort of situations.
okay, thank you.
Okay.
Can I just ask something, Patricia? If it's someone who's just a driver and not a member of the Buddy Connection, they probably should contact Jeff
That's
Brown.
yes, but I don't know whether he wants to be contacted for that sort of thing. Is there a protocol in place? I can't remember, to be honest. I thought we had one.
I'm not sure.
Okay, we should actually look at that probably at board level and see about that, because that's something that's really important. Okay, so anyhow, I'm going to hand over now to Michelle. She's going to start talking about alerts to watch for in aging adults, and you're in good hands with her. She's been in the care aid industry for many, many years, is a certified nursing assistant, and has worked with seniors for many, many years, as I said. So this is Michelle. Thank you. All right.
Okay. Hello, everyone. I'm Michelle Bullington.
Hi, Michelle.
Hello, hello. Okay, can everyone, hi, can everyone see everything okay here?
Mhm.
All right.
We don't see all of this. You've realigned it, I guess.
Oh, okay, thank you.
We're not
so-
seeing the whole picture here.
Let's see. So I have we're open here. You can't see the whole picture?
There, now it's a little bit more
We
aligned.
can't see all the faces. We see your presentation. We just can't
Waste
see
of
everyone
time,
on the
you guys.
line.
Oh, okay, yeah, but you can see all the presentation?
Yes.
Okay, wonderful,
Yeah,
wonderful.
you can go down to the bottom and look at participants if you want to, if you want to see who all's on it. But yeah, we can see I can see the presentation. I don't know, but anybody else.
Okay, wonderful. Okay, so today what we're going to do, we're just going to talk about, as you can see, the alerts to watch out for in aging adults. And actually, when you think about it, really in anyone. But obviously our primary focus is on seniors. So today we're going to talk about the physical changes. So just go through this nice and easy. Okay. Interaction with aging adults can be challenging at times. It is important to allow them to maintain their sense of freedom and independence for as long as possible during the aging process, treated with dignity and respect. While in his or her home or accompanying them to an outing or event, take time to observe behaviors. During visits, whether you're driving, going inside the house or not, maybe just a door to door, you can notice changes in condition. Very simple, as maybe noticing they are walking a little differently today, maybe talking a little differently today. Maybe you are having a conversation, let's say, about a football game that just happened, and then all of a sudden, within mid-sentence, they shift and talk about a birthday that happened and completely forget they were talking about a football game. So little things like that. We'll go into more details Physical could also be, you know, as you can see here, if you notice, maybe they generally have a tidy home and you notice things are more messy than usual, just like with anyone. You notice, hey, they have a tidy home, it's messy today, maybe something's not going so right. If you notice that there's things piling up in front of the door, maybe like newspapers or mail, little things like that can be key indicators that something might be off, even whether it's something stressful, emotional, or maybe they're just forgetting. So, is that okay for everyone so far? Any questions? All right. So, we're going to skip. So, the next lesson, we're going to talk about personality and mood. We'll go into forgetfulness and confusion. This will be the mental, the next one. So now let's start off with appetite and nutrition, which is what I think for any of us, any age, you notice unusual poor eating habits for anyone. If you notice you're, you know, taking your buddy, you're going to a doctor appointment, you go out to lunch, you know, they usually maybe you'll have, you know, breakfast, you know, maybe a bagel with some veggies on it. And then the next few buddy visits, you notice, oh, they're ordering bacon and cheeseburgers and fries. And, you know, maybe they're drinking a double latte when they generally drink decaf. These little indicators you can tell with anyone that something is changing. If it's just maybe a day one off, or, you know, once in a blue moon, you notice they have a little change, that's normal. If you start to notice a pattern with anyone in your life, they're starting to change their eating habits to poor eating habits. Now, healthy changes are always good, but the poor eating habit changes, you notice they're always eating fast food. Maybe you notice you give them a hand with their garbage and you notice the garbage is fuller than normal. Well, that generally is an indicator that maybe they're eating out more rather than cooking at home. As we all know, myself personally, when I eat out more than when I cook at home, generally it's higher fats, higher, you know, sugar, all that. What's that?
Salt.
Oh, higher salt content, the whole 9 yards. So just noticing overeating, indulging. Now we're going to go on the opposite side of that spectrum. We're going to go to the decreased appetite. Just like with anyone, if you notice someone, you know, they're not eating their usual meal. Granted, maybe it's a health choice. That could be positive. However, if the negative side of it could be maybe they're stressed, maybe they're depressed, maybe they're sick, maybe something's going on internally that they're not aware of, but you're noticing because they're not eating the same amount of food that they normally do. So just check in. Oh, yes, question. View. Sorry, we had a question. So I'm just still learning how to how to click this here.
It's Ed McKibben, I think that's got a question.
Okay, and then do I just click on him? I'm sorry.
But he's on mute though.
Oh, you're on mute. Oh yeah, go for it. Okay, that's why. Uh-oh. You're on mute. Or maybe it was an accident. Oh.
Earth to Ed.
Hello, Ed. Maybe
He'll
we'll,
come back.
Ed, you can just jump in and interrupt. It's okay. Okay, so that's two sides of the spectrum. We have our overeating, our decreased eating, changes in what types of foods you're eating. Another key indicator for all of us is water intake. That is the biggest thing. When I've worked on the floor in hospitals, communities, we're always trying to push water, even on myself. I have my 24 ounce of water over there. I keep it with me all the time just to even remind myself to continue to hydrate. Granted, you're going to use the restroom a lot more, but you know what? It's better to use the restroom a lot more and stay hydrated to keep yourself as healthy as possible. So if you notice someone's maybe not drinking enough water, I always just say, hey, let's grab a water with that. Or if your waiter comes up, say you're at, out at a meal, or even the cafe at Starbucks, grabbing a coffee, maybe just grab a little glass of water with that. I always say yes if they offer water. Just a good habit to have from the nursing side. So the second biggest thing for most of us is expired or rotting food in the fridge or pantry. We're all guilty of it. You buy some meat, you throw it in the freezer, you forget about it for a while. Maybe you buy some beans for emergency, earthquake preparedness. Hard to do, but as much as you can, maybe during spring cleaning, double check everything in your own fridge and pantry. That's my rule of thumb. And that I learned growing up from my mother was every spring cleaning, we're checking everything in the house as well as the fridge and pantry, including our emergency kits. So another way, if you're going in with a buddy or even one of your friends, you're going in, you notice they say, hey, let's have a meal together. You're having dinner at their house, whatever it may be. You open the fridge, you notice, oh, wow, there's a lot of food in here that, maybe doesn't look so right. Maybe the meat doesn't look good. Just take a peek at it. Take a look at the expiration date if you can, for anyone that's, close to you when you're in their home. Look at the food, rotting food in the fridge, that something can be changing, whether it's memory or even just physically too tired to throw it out. Another thing can be, like I said, in the pantry, you can just forget all about the food, forget that it's there, whether it's old pasta sauce or, cans of beans or soups. Granted, we all know certain food can live a little past the expiration date, but it's always best to throw everything out because, go ahead.
Can I have so would you address this with the buddy, or would you tell the program manager, or would you tell the?
I would address it with the buddy first because, you have a good bond, right? And you just say, hey, I've noticed some of these things, are you still going to eat this? Are you still eat that? And some buddies may say, oh, that's good for another year.
Okay.
Actually,
But-
Pam, you're the buddy. The buddies are us.
Right. But I'm just asking, do I address my
You
buddy?
address
I
it with
mean,
the actual member.
yeah,
Yeah, your
the
partner.
member. I guess I thought, yeah, you're both kind of buddies with each other, I guess. I don't know.
Yeah.
Yeah, so the member. I guess it's,
Yeah,
I
you want to call a
I
member
phrased
to
it wrong.
differentiate.
The
Yeah.
member. You discuss it with the member. That's what I was
Yeah.
meant.
Yeah, discuss it. Yeah, discuss it with the member, just as you would, when you're good friends. Like I said, doesn't matter what age, anything, you're in someone's home, you notice something off, say something. Now, if your buddy, your member, maybe is a little, gets upset by it or is taken back or says no, like I know this is good for another year and so I would just take note of it and then maybe bring it up to would it be one of the managers here?
Yeah, that's what
Okay,
I'm.
and just bring it up and talk because,
Okay.
just to chat about it and just make a little mental note. And maybe it is just that one thing that, hey, some things are okay or maybe not. It's a little gray area with certain things there.
Okay.
But my biggest rule of thumb is just throw it out because it's not worth it. Even if you think it's still okay, if you eat it, something happens to you, that it's just not worth it. Yeah. So that's a big thing to look out for. Once again, that would be expired or rotting food in the fridge, freezer, or in the pantry. If you notice, mold on anything, just throw it out. Obviously, make sure you inform your member, hey, by the way, I noticed all these things. Once again, if they say, great, thank you, I didn't realize that, throw it all out together. If there's any pushback, they get upset, maybe they don't recognize or notice that it's rotting or that there's mold on it, then best is just say, okay, no problem. You don't want to upset anyone any further. Then I would say, as soon as you walk out of that residence, make that phone call because you don't want anyone to eat that food.
Right.
And you also don't want to get into a fight and all that and ruin your relationship just because maybe they don't, maybe they can't physically see it anymore. Yeah. And that's what I've had to do before, being a nursing assistant going into homes. I've had to do that a lot with my own grandmother, who is very much a stickler of it's not expired, you know, there's another year left. And, you know, it took us some time, but eventually, being that we were family, I was able to kind of sneak and throw everything out. But that's, yeah. So, any other questions on appetite and nutrition? Okay, one more thing with the nutrition side. If you notice that there isn't enough, like I said, water, maybe vegetables, fruits, granted, not too many fruits depending on the sugar intake. If you notice that there is just not enough healthy items in the fridge or pantry, maybe there's too many cupcakes, maybe there's too many, you know, salted chips for any of us, any age. You notice something like that, maybe talk to your buddy, talk to your members, say, hey, you know, what's up with all this here? Maybe it's their stockpile, you know, for the whole year, maybe not. Just little things like that. Yeah, okay. We'll get to the next one here. So this is a big one to look out for. Physical changes in hygiene. Now, limited mobility, poor coordination, frail and lack of strength, change in posture and gait. It's the biggest one. Let's talk about that. If you notice, anyone, yourself, anyone included, that you are starting to feel a little dizzy, you are having a little lack of strength. Granted, maybe it's a little cold out like it is right now. It takes a minute for your muscles and blood to start flowing once you get going. But if you notice that you're aching a little more, your member's aching a little, your partner's aching a little more, poor coordination, you notice someone is maybe dropping things more, maybe it's hard to, let's say, write, or even hold a bag of groceries and open the door, something is going on. Granted, may happen once in a blue moon, wouldn't be nothing to really worry about. If you notice a pattern, the biggest thing in alerts and warning signs for anyone in changes, whether it's mental or physical, is if it's something that's consistent. Consistency. So if you notice something once in a blue moon, take a note on it, and it becomes consistent, then bring it up. So once again, limited mobility, poor coordination, lack of strength, and a change in posture and gait. If you notice, as we all tend to, eventually we kind of go like this, right? If you notice that's going on and they're leaning more, something is wrong. Maybe there's a slip disc. Maybe something happened. Or maybe there's something mentally going on. It could be a sign. We'll go more into that later in our next lesson, but it could be a type of one of the many dementias. Next would be staying in one spot more than another. Issues going up and down the stairs. These are all concerns. The up and down the stairs are concerns for possible falls. So if you find yourself or anyone else just, you notice, hey, they've been in their, in their TV chair for a long time, for over 2 hours, for any of us, myself included, the rule of thumb from nursing assistants all the way up to the RNs and doctors, every 2 hours move. Even when you're sitting in an office, I think there's new rules they have out now where you have to get up for 10 minutes and walk around. Just get yourself up. Get up, move around, go to the bathroom, grab a glass of water, grab a little coffee, whatever it is, go grab the mail, just to get up and move. Oopsie daisy. Okay, I'll bring that down there. Going up and down the stairs. Knees, muscles, everything, especially with the colder weather, can get tight and achy for anyone, whether you're a senior or maybe you have been in sports most of your life like myself. And I, have some injuries. I rode dirt bikes for 20 years. So, so I have some pretty good injuries when it gets cold. Even myself, I can feel little aches and things when I'm moving. Once again, the longer you sit in one place, whatever it may be, the harder it's going to get up and move. Going up and down stairs, if you notice that you or your member are having trouble going up or down stairs, just be close by. Ask if it's, you know, hey, is this usually what happens? Do you usually have a difficult time? No problem. They're probably on it. They have their doctor. Maybe they have some PT going on. Maybe, like I said, there's some old injuries. We're just having a hard time, especially with the cold weather. Now, if they don't have that, and it is something that you notice, hey, you know, Mary Kay is, you know, she's a runner. She runs, she does this, she does her triathlon. She, you know, I was watching an 80-year-old woman won one of those triathlons. It was just really inspiring. She's going, she's better shape than me, going, doing her thing. If you notice someone like that who's generally walking, maybe athletic, you know, maybe still going to the golf course, doing walks, and all of a sudden you notice, hey, they're having a really hard time getting up and down those stairs. Something's wrong. Injury, maybe there was a fall that they don't remember, or maybe they don't want to tell you. So once again, trouble going up and down stairs for anyone is very serious for possible risk of falls. Always make sure you're hanging on to that rail, because if you fall, you break something, it's going to be really hard to recover. So next would be unexplained burns, bruises, or cuts. That could be a fall without remembering. I've had a handful of patients in the past that were in home that just remembered one week that they fell, told me all about it, charted everything, took note. Okay, no problem. Things happen. Go to the next week, they completely forgot. So if you see any unexplained arms, bruises, ask, hey, what happened? Oh, I cut myself. I was chopping, you know, tomatoes. Or you see a really big bruise on the arm. Okay, what's going on there? Maybe they banged when they fell. Burns are also very serious, because if you notice more burns, granted, we all get little ones here and there from cooking in the oven, but if you notice something large, maybe they forgot to turn off the stove. Maybe you forgot, you know, all the basic things to look out for. Now, let's see. Any questions so far?
No.
No questions? Okay. So as you can tell, most of these are basic things that we all try and remember and keep an eye out for, but just know that you are each other's advocate at this time. So not that you're not a caregiver by any means, you know, you're tired, you're relaxed, you're just there to be buddies and members and friends and take care of each other, but you're looking out for each other. So just remember that if you see anything that's unexplained, ask about it, and also follow up with, if it's appropriate and you have that bond, to say, hey, have you talked to your doctor about it? You know, have you talked to your doctor? Have you gotten it checked out? You know, because also when someone falls, a while back, I bruised my ribs surfing. Didn't realize I did it until 2 hours after I got out of the water. And I didn't know what was going on, didn't think much of it. I was in so much excruciating pain. I had to go to the ER. They did the x-rays, they did everything, said, hey, you bruised your ribs. Okay, so what's going on? Now I have a little nerve damage, but guess what? Only reason I was able to go is because my partner said, hey, you need to go. There's something wrong. I did not want to go. I said, I'm fine. I'll be fine. So I'm using this as an example because we can all be that way. Hey, fine. I took a fall. That's all right. Very glad that I had someone there to say, you need to go in, because generally with falls that come around your ribs, when you fall down the stairs, you can hit your ribs. You could puncture a lung and not know it. You could have internal bleeding. You puncture a lung, you get pneumonia. Chances of survival lower because you won't be able to catch it in time. Lungs fill up with water. Internal bleeding, same thing. Also, you have to remember when there's falls, if you hit your head, any age, you hit your head, no matter what, I always recommend just call the doctor. Call the nurse, call the on-call nurse. Most of it, you know, they'll have insurance. That's what it's there for. Just call. Just say, hey, I did this. They'll run through everything. They'll say, okay, maybe you should go in. Maybe you shouldn't. If you're ever with a member they fall down the stairs, number one thing to do, don't pick up, don't touch. That's the biggest thing because you're not sure what's going on. And that is the rule of thumb in any of the communities. I'm working as a nursing assistant. Don't touch, don't pick up, ask certain questions, and then follow the protocol, which for the village is to, I believe, call 911. Is that correct?
Yes.
Yes, to call 911. Let me go back here. Sorry about that. Oh, sorry. Would be to call 911 and then contact the emergency contact. Now, granted, let's say they fall and you just slid on your bottom. Sorry, let me go. Daisy, sorry. Let's say you fall, you slide on your bottom, everything's fine. You ask questions. Hey, what's your name? What year is it? Who's the president? Sorry, one moment here. Sorry, just got a little click here. Mom Patricia's computer today. Okay. So once again, number one thing, if someone falls, to make sure, don't touch, don't move, don't try and lift, ask questions. Are you okay? What's your name? Where do you live? Where are we right now? Just simple questions that all medical staff you'll hear generally ask to see if they're cognitively okay. And then you ask, can you move on your own? Can you get up and move? And if you notice something is wrong, just call 911. Because what will happen when you call 911, you'll talk to the operator and they'll just send in the EMTs, possibly whether the EMT, the fire department, they'll come in, they'll hook up the AED, they'll check your vitals, they'll check you out, physical checkout. And then if for some reason in their assessment, they notice maybe there is some type of internal breakage or bleeding, they'll be able to lift you. Granted, if it isn't that severe and everything is okay, you just took a fall, they can help you get back up safely. They have their lift team in place. It's generally big guys, the big firemen that come in and they get you up. So once again, when it comes to falls, it's just make sure you're there with your buddy. If you notice something's wrong, call 911. Does that sound okay to everybody? Okay. So we'll go into poor hygiene, pressure ulcers, lack of motivation to bathe or shower, physically unable to, symptoms of a UTI, which are something to look out for everybody. So poor hygiene, pressure ulcers. If you're physically unable to get up and bathe or shower, the biggest thing to know is if you're with your buddy and you just notice they don't look well kept, and they normally do. Or if you notice right away it's a new buddy and you're like, they're not well kept, but maybe that's just how they are. There's some folks that are like that. That's okay. They're a little more organic, whatever you want to call it. Okay, that's all right. But if you notice things like there's a certain kind of smell, or maybe they're just a little dirtier than a normal person, something is going on mentally. If you can't notice yourself, when you're not well kept, then there's something wrong, whether it's, like dementia, depression, anxiety. We'll go into that the next lesson. So just know poor hygiene, which leads to pressure ulcers. Also leading to, if you sit in one place for too long, anyone sitting in one place for too long, you can develop in a certain area. That's why a lot of us will have cushions on our chairs, because, you start to get a little indent, skin will start to rub, and then what happens, your skin will start to break down from sweat. Or maybe you're wearing Depends and you have some urine on there. And if you don't change, if you don't clean, you will get pressure ulcers, which there are 4 stages. Very important to know. It can look like redness on the skin, a scab. It It could even happen right here if I'm just leaning for too long. You know, you'll notice a little indent. But now imagine if I didn't realize anything and I was leaning there, I was sweating. Next thing you know, it gets a little red, itchy. And then the skin will start to break down and you will have to see a nurse because it runs risk of infection. It can happen with your feet a lot. If you are the heel of your foot, the middle of your foot, let's see. Here are key places: hip, tailbone, heel, midfoot, ankle, those areas that generally rub everywhere. Bed sores. So if you're laying in bed for too long, you're sweating, you don't realize it. If you start to notice a little bit of, you know, itchy skin, redness, just wipe it off, clean it off. If you don't realize it, you notice that your skin's starting to open up, just call your doctor because they'll immediately go and put some antibiotic ointment, clean it off. The worst case scenario is if, let's say you have someone and maybe you haven't seen them in a week or two and you see them and they haven't taken a shower, rinsed off in the bath. Guaranteed there will be pressure ulcers with possible infections. So that would be just give a call, you know, give a call to the management and say, hey, this is what's going on. And then they can advise you from there because that would most likely be, you would call the doctor, they would go in full skin examination as well as, you know, mental and physical examination. So those are pressure ulcers, bed sores, that. So lack of motivation, physically unable to. If you notice that you or your buddy or anyone is just physically unable to start getting in that shower, in and out, you know what? It may be time for some safety bars, which a lot of apartments and homes now have those, which are wonderful for anyone getting in and out of the tub. You can get the safety bars put installed. There's a lot of places that'll do it for really cheap and they're really great. They come out. And even if, let's just say, you know, you're just a clumsy person, you know, if you notice in a lot of the hotels, they have the bars now, the shower bars, the handrails. If you're just a little clumsy, get those installed. It'll save you from a fall and possibly hitting your head, which is the number one. Never want to hit your head. So once again, limited mobility, poor coordination, lack of strength, posture, something is wrong. Staying in one place, you notice, hey, I went to go see, you know, Sally, and she was, you know, she was in the kitchen sitting at the table, and I got here this morning and she hasn't moved in about 4 or 6 hours. So then, you know, at that point, there might be pressure sores developing as well because not getting up to use the restroom. Falls, once again, if someone's having trouble getting up or down the stairs, be next to them. Can't catch them when you fall because you don't want to fall and hurt yourself as well. Be there close by, you know, if you can, maybe an extra hand, walking up and just take note and talk to the managers, let them know, because it may be time for a caregiver, whether it's a family member or an outside service. My personal is to have a family member or a close friend who you trust to be there with you. It just saves in cost and it keeps things, you know, more personal. Unexplained bruises, cuts, or burning, poor hygiene. One more thing, a symptom of UTIs for any of us, males and females, regardless of age. If you notice that you have urinary incontinence, happens to everyone at any age. They're telling you it doesn't, they're lying. I'm in my late 30s, it happens to everyone. If you have a UTI, especially low blood pressure, accelerated heart rate, your heart rate's going, a lot of us now have these little watches, even then you know when your heart rate is going fast. Low blood pressure, which means you're just kind of slumped down, but you have a high heart rate. Urinary incontinence, even if it's just a little trickle. Poor appetite, you're not hungry, you're tired, you're noticing that you're off balance, maybe you're stumbling a lot more. And the biggest one is delirium, which is, these are the key indicators for a UTI. All you do, call the manager, let them know, they'll contact the responsible party, get a hold of their doctor. 9 times out of 10, they'll just prescribe you antibiotics. Granted, if you're on different medications and things of that nature, your doctor will know, okay, this is what we need to do. First, actually, they may have you do a urine sample to be 100%. Now, for some reason, you can't get into the hospital. They may just prescribe you antibiotics, depends on your doctor, how long they've known you, you know, all that good stuff. That's just the inside to let you know. So once again, UTI for anyone, any age, watch out, male and female. Another big thing you can notice, the urine has a really potent, pungent smell, and it's very dark. Potent, pungent, and dark. Filling out of it. Delirium is another thing. If you notice that someone, say you can't obviously see their urine, things like that, you notice these other things. You notice that they're really, you know, kind of amped but drowsy and really acting just irrationally, maybe talking about things that aren't there. And you know, hey, this person, you know, doesn't have cognitive impairment. They're not like this. They probably have a UTI. Most of the time, that's what it is. Any questions on that? I know that's a lot, and we'll be able to go over all of this again and all the fun stuff. Okay, real quick. I realize we're about 5 minutes, but we'll go a little bit longer. I know it'll still be the 45 if everyone still has time. Safety hazards, very basic. Hoarding, messy house, forgetting to clean up, don't have motivation or physically can't. No paths for escape in the event of an emergency. Electrical cords and wires laying on the floor, crossing your path to walk, maybe too many plugs in an outlet, fuses blowing. Maybe you notice one of the outlets doesn't work anymore. Maybe another one doesn't work. Another key indicator that when I was going primarily into homes daily, full time as a care manager for a home care agency, I would notice when I would do my safety and quality assurance inspections, lights would not work, light bulbs. So a lot of the times I would go and just change the light bulbs. Takes a few minutes. Granted, you could have one of the kids do it. Maybe you're up for doing it. Adequate lighting is everything for all of us, especially as it gets darker earlier. So just always make sure your light bulbs are working. Even a side note, your smoke detectors, you hear the little beep. Call whoever it is that you know, take your handyman or woman that takes care of everything, or just pop up there if you're safe to do on a ladder. No, do it yourself. Just change that battery out. It'll take you 5 minutes.
No, there's,
And then
yeah, feel nutritional, they're much better than, and besides, because I keep.
I think you've got to put mute. That's all right. Can you guys still hear me okay?
Does a little thing like this.
Oh, can you still hear me okay? Yes. Oh, yes. Oh, okay. Yes. Okay. Sorry, just checking. Okay. So once again, you're with your buddy, you go to the door, they go in, maybe you don't go in for a cup of coffee or whatever it may be. You notice, wow, they have a lot of boxes and stuff just blocking their doorway. People's just peeking in. You notice, oh wow, what are all those cords doing there? Or maybe just a bunch of junk everywhere. Maybe it's old newspapers. Really talk to your buddy. Say, hey, you know, Mary, what's going on here? You know, everything okay? How about I help you clean up? A lot of times when you're hoarding, have a messy house, there's a lot of mental. See if I can mute him. I don't think I can.
You should be able to.
I should? Okay. Okay, copy.
Well, you go, wait, you go.
Oh, participants. Okay.
After you ice your.
Hey, Ben.
Oh, ice both things nicely. You go in your car and sit in the.
Hey, Ben.
Check out how your foot feels, you know.
You know what? I think it's because we're not the host.
Back up. And see how it feels, you know.
Oh, wait, here we go. No, I can mute. I can only mute myself.
Sit in there for a little bit.
Okay, he'll have to mute himself.
You know, test it out, move your foot with the gas.
Can we, so, who is it? Who's the host of the meeting? They'll be able to maybe kick him out, bring him back in politely? Okay. I think he got the memo. All right,
I
so
just, I just sent something to him.
okay, thanks.
Yeah.
Okay.
I
So once
worked. All right.
So, just like with anyone, like I said, any age doesn't matter. You're going into your children, your grandchildren's home, your colleagues, your buddies, your members. You go in, you notice they have a messy house. Granted, they may be just messy. That's okay. But
Oh, and I am going, I did get my ticket for.
key
I
indicators
guess.
are here, right here. There's no escape for an emergency. There always has to be 2 exits, right? Make sure there's a clear pathway to all doors. Make sure that there isn't a lot of wires hanging around anywhere. If you notice there's everything's plugged into one socket, make a note, let the team, the manager know, and just that way, and let your buddy know, hey, what's going on? They may say, oh my gosh, I wasn't thinking, I didn't realize it. They unplug it, maybe can help them out, or management can come in and give an extra hand with that protocol. Debris is the biggest thing. Just make sure that there are clear pathways when it comes to hoarding. As we know, the walls are up, but you're able to at least make a pathway. But if you do notice that, at least you can have those extra eyes in. You can let the, management know, and they can start the process with whatever's the family or whatever to start to help with the hoarding. And we'll go more into that with mental, but at least it can get started to slowly clear things out. And last but not least, we have our showers, tub, everything. When it comes to that, you just want to make sure that the tubs are clean. There's mats in the tub. Let's say you don't need a mat. The way that it works, it's not slippery. Grab bars, grab bars, grab bars. I am an advocate for grab bars for everyone, any age. Anyone can fall in the tub. Most falls happen in the tub regardless of age, gender, size, anything, doesn't matter. Those are most incidents. So when it comes to bathroom, shower, slippery areas, say you have a pool area, you have a pool house, grab bars. Grab bars at the entry. Railings everywhere, anywhere you can grab onto, because it can save you and your buddy's life and anyone else in the home. Just in case there's ever an earthquake, which we're an earthquake, we haven't had a big one in a long time. Something happens, we all know where to go. What if there's stuff in the way? What if you can't get into a door frame? What if you can't run outside because everything's falling? So those are other little things to think about when we're thinking of safety hazards. So any questions? How does everyone feel so far?
Very nice.
Is it okay? Is it the pace okay? And is it everyone taking it all in?
Yes, thank you.
Okay.
Yeah, it's been very nice.
Okay, good. Thank you. And it's just, just basic little friendly reminders to us all. And once again, any age, doesn't matter. All these things apply to everyone. And even yourself right now, if you notice, I have a bunch of cords plugged into that one socket. Long time ago when I got out of high school, I used to work for ADT.
Yeah.
So I can tell you this right now. If you have
I
a
just
power
had safety
strip,
bars. I just had safety bars, put into both showers. So,
perfect.
yeah, it was a necessary, very necessary. Yeah, you,
I mean,
you never know.
Yeah. And especially just that little, reminder of, oh my gosh, what if I'm in the shower and an earthquake happens?
Yeah. Oh, yeah.
Hang on. There you go. Yeah. And just a note right now, little rule of thumb for electricity. If you have a power strip, always leave one section open. Don't plug everything into a power strip. This is just from me personally, when I used to work with electrical. So
Yeah.
even in my own house, all my stuff. So you have a whole power strip, say there's 6, plugs, outlets, only plug in 5. Because that's less of a risk of blowing the fuse, and then the igniting and catching on fire. Yeah. And let's see, I think that's about it for physical right now. So once again, let's just go back here to the fun stuff. Limited mobility, you know, your posture's different, you're off balance, you're having a hard time going up and down stairs, maybe you see some bruises and cuts. One more thing about the bruises and cuts. If you notice that there is like a hand, then someone is grabbing them. Very, very, as a mandated reporter myself, we would know when people were being grabbed or transferred wrong. If, say, you're wheelchair bound or something's going on, or maybe you're just there. If you notice that there are bruises like a hand, little ones, they are being grabbed. Immediately contact the management and let them know. Yeah. Granted, best case scenario, maybe it was someone trying to help them and they didn't realize and they didn't know. Best case. Usually that's not the case though. So just something to think about. Little bruises, little things, hands. Yeah. Okay, so we have that, symptoms of UTI. Remember for yourself, most importantly, if you notice an accelerated heart rate, you're nervous, you're anxious, but you're tired, you're drowsy, you're out of it. Maybe you yourself are seeing things that probably aren't there. Maybe your niece or whoever's telling you, you know, Auntie May, you're pretty crazy right now. Call your doctor. Most likely UTI, you're not losing.
Yeah.
Is that right, Patricia?
Yeah, and they're going to the toilet frequently with only small amounts of urine.
And going to the toilet frequently with only small amounts of urine. That is one I forgot. So if you're going nonstop and only little by little, yeah.
And you know what you had mentioned emergency earthquake. I don't know that we've addressed that in some of our things. I don't know. I don't remember that. It could be in, I've only been in the agency for like a couple of years, but I think that and taking your phone with you when you go to the bathroom, if you have a phone, is really a good idea because you can getting up and down and everything. So those are a couple of things takeaways that I hadn't thought about is the emergency if you feel an earthquake. I don't know whether we address that. Maybe Patricia or somebody else can chime in with that.
Yeah.
Yeah.
We've talked about it in the past and I don't think we've got any protocols in place and that would be a good thing to do.
Yeah.
Yeah. Yeah. So, okay, I'll put the little reminder to Patricia here, but, that's great, Pam. Yeah. Keep your phone with you. And, I'm also an advocate of the quick, emergency buttons.
Life
The
alert.
life alert. They're amazing.
Yeah.
Just keep it with you. Why not? I mean, most of the time with your
Yeah.
insurance, it's covered. Most of the time, Patricia, right? Yeah, it's covered. Keep one on you because you know what? Let's say, all your emergency contacts, the kids, wife, husband, whoever, they're at work, they're doing something they don't know. Maybe you both fell. Maybe everyone fell. Maybe there was an earthquake emergency. Just push it.
Mhm.
You're taken care of. That's the great thing about technology these days is that we have that opportunity for safety. Yeah. So that's what we have for our physical parts for the alerts to watch out for in aging adults. And I like to say in everyone. Physical changes. Let's see, here we are. Our physical changes, balance, hygiene, appetite, nutrition, and safety hazards.
Thank you.
Yeah, thank you. And then our next one, we're going to talk more about the mental side of things, which is a change in personality and mood, and our forgetfulness and confusion. Which changes in personality, mood, forgetfulness, confusion. The closer you are to your buddy, the easier it'll be to see. Just a little side note, just like with anyone. Yeah. And that will be on the 26th, right? Same time?
Yes.
So, any other questions or comments or constructive criticism?
Sorry, I raised my hand.
Yeah, we saw it earlier. That's all right.
Thank you, Michelle. It was very clear and you presented it very nicely.
Very
Okay,
nicely.
all right, that's great to hear. And if you do have any questions in the meantime, you can shoot an email to us. And I'm more than happy to send you any, questions, answers, whatever you have, and look stuff up, whatever it is. Because we're all in this world together.
Yep.
Yeah,
Oh,
and I
yeah.
just live here in San Mateo, so you've probably seen me at Safeway or around here somewhere.
And I know.
And Patricia knows how to find. Yeah.
All right.
Thank you.
Thank you,
Thank
Michelle.
you. See you next time.
Thank you. See you next time.
Thanks, everybody.
Yeah.
Thank you,
Thank you
Patricia.
very much
See you
indeed.
later.
We'll see you all
Okay,
soon.
see you next time. Have a great weekend, everyone.
Thanks. You
Bye
too.
now.
Bye-bye.
Okay, be safe out there.
Yeah.
Thank you.
Stay
you.
warm. Stay warm. Bundle up. Okay.
All right.
All right, everybody. Bye-bye.
Bye now.
Did they interact?